Again, welcome. Thank you for joining the Systems for Action Research Program and our regularly recurring Research in Progress webinar series. We come to you about twice a month, featuring some innovative research being conducted through the Systems for Action Research Program of the Robert Wood Johnson Foundation. I'm Glenn Mays. I'm the director of the National Program Office for the S4A program and a professor here at University of Colorado. If you are new to the S4A program and to this Research in Progress webinar series, the basics you need to know is that S4A is a national signature research program of the Robert Wood Johnson Foundation, and we study innovative ways of helping medical, social, and public health delivery systems work better together to align their efforts in addressing issues of health equity and advancing health equity for communities across the U.S. We study innovative ways of helping those different kinds of systems work together in places all around the country and addressing many different problems and sources of health inequity that need to be improved across the country. In this webinar series, we profile one or more studies that are going on through the S4A program and have a chance to learn in almost real time what's being done, what we're learning through this work, and obviously have a chance for all of you who are joining us for this webinar to ask questions as well. A few housekeeping issues. We are recording this session. After each of our Research in Progress sessions, we we'll archive the recording and the slide set on the Systems for Action website at systemsforaction.org. So feel free to pass that along to colleagues who may not be with us for this live session today. Also of note, we're a national research program. We fund new research projects every year, and our next call for proposals for new research proposals in the S4A program will open up next week. We will publish our new call for proposals on December 13th. And again, you can access that new research opportunity on our website, systemsforaction.org, and also from the Robert Wood Johnson Foundation's website at rwjf.org. So without further ado, I'm very pleased to introduce our panelists for today's Research in Progress session, where we're going to showcase the great work of the System Alignment Innovation Hub. The Innovation Hub is a relatively new component of the S4A program that got up and running about a year ago. This is a program that we designed to create more space for non-research organizations, for community-based organizations and practice-based organizations to engage in our research program. We know that the best ideas for how to align medical, social, and public health systems don't necessarily come from the scientific community and the academic community and researchers, but a lot of the ideas for how to align systems and make them work together for advancing health equity come from people on the ground, working within these systems and working with communities that experience health inequities, systemic racism, and other drivers of inequities in health and well-being. And so we're really excited to have this new System Alignment Innovation Hub up and running, and really exciting to have the first cohort of grantees, community-based grantees and research teams beginning their work under this program. So without further ado, I'm going to turn it over to our panelists for today's session. I'm going to actually turn it over to LaMont Green, one of the leaders in the System Alignment Innovation Hub, to introduce the rest of our panelists and to take it away.
Thank you so much, Glenn. And we are so thankful at TAC and HSRI for this possibility of standing the Systems Alignment Innovation Hub. So just huge kudos to the Robert Wood Johnson Foundation and for the Systems for Action team, Glenn, Carrington, Sedina, and team for all their work and trusting us to guide this work as well. And so my name is LaMont Green, and I'm the director of the Systems Alignment Innovation Hub, and I use he, him pronouns. And I have two of my colleagues here who are going to introduce themselves in a moment. And we are so fortunate to have one of our grantees here joining us, who you will meet, Community Connector, Vicky and her team. So Lori, would you like to introduce yourself?
Hi, everyone. My name is Lori Pampilo Harris. My pronouns are she, her, Oya. That reflects my Indigenous identity, more familiar to you as a Kanaka, as a native Hawaiian. My Indigenous ancestors came from Diana, and we have long been protectors of Diana. I also identify as Filipina, a daughter of an immigrant, where our family is descendant of the Mandayan Muslim clan. I'm also a person with lived experience of homelessness, extreme poverty, and displacement. And it's wonderful to be in community with you all as we begin to share the work of the SAIH.
Thank you, Lori. And Rachel.
Hi, good morning, good afternoon, everyone. My name is Rachel Post. I use she, her, hers pronouns, and I identify as a white Jewish woman. I have the privilege of being the Associate Director for the Systems Alignment Innovation Hub and working with these amazing individuals who I learn so much from every day. Thank you for joining us today.
Thank you, Rachel. And something that's really unique about our team too is that we're 50% people with lived experience, whether that's lived experience of homelessness or lived experience of being involved in these systems that we're trying to heal and to have align to improve health equity. All right, so Rachel is going to take us through our agenda, and then Lori is going to lead us with the land acknowledgement.
Thank you, LaMont. So we've done our welcome. As LaMont said, we're going to do a land acknowledgement. I'll do a labor acknowledgement. This might be a little bit new to you. I think a lot of communities are doing land acknowledgements and have been for many years. Lori does a very, shares a very meaningful land acknowledgement. And then we're going to talk about the origins of the Systems Alignment Innovation Hub. Glenn gave a little bit of background. LaMont will give us more. And then we're going to introduce Community Connector, which is one of our grantees. We'll give you a quick rundown on the other 3 grantees. And then we're going to talk about our peer learning network and have lots of time, hopefully, for questions and answers. So with that, I'll pass it over to Lori, and you can move to the next slide. Thank you.
Thanks, Rachel. Today, we would like, next slide, please. So as we're moving to the next slide, today we would like to begin by acknowledging the Indigenous peoples of all of the lands that we are on today. While we may be meeting today on a virtual platform, we would like to take this moment to acknowledge the importance of the land and resources which we all call home, but is and always will be native land. We are doing this to reaffirm our commitment and responsibility in improving relationships between sovereign nations and to improving our own understanding of local Indigenous peoples and their culture. From coast to coast, we acknowledge the ancestral and unceded territory of all Indian tribes and tribal nations. And despite centuries of genocide and occupation, the Native people continue as vibrant and resilient tribes, bands, and rancherias. We were never the savages. We are in this virtual session together. We acknowledge and honor the original inhabitants of our various regions. These sovereign people have been caretakers of the area since time immemorial. For myself, I recognize that each moment I am on native land, she nourishes and gifts me with the opportunity to breathe her air, eat from her soils, drink from her waters, bathe in her sun, swim in her oceans, be kissed by her rains, and be embraced by her winds. We want to further recognize that generations of Indigenous people and their knowledge systems have shaped our earth in sustainable ways that allow each of us today to still enjoy these gifts. Let's take a moment to honor these ancestral grounds that we are collectively gathered upon and support the resilience and strength that all Indigenous people have shown worldwide. Next slide, please, and handing it off to Rachel.
Thank you so much, Lori. Since coming to this team, I've learned, as I said, I've learned a lot. And one thing I've learned is how important it is to do a labor acknowledgement, to recognize the exploited lives and labor that resulted from our history of enslavement. And so I'll read this acknowledgement. We must acknowledge the legacy of slavery in this region and the enslaved African people whose labor was exploited for generations to help establish the economy of our region and the United States. An estimated 10 million enslaved Africans were forcibly brought to the Americas beginning in the 1500s until 1867. The labor of slaves built many of the civic and federal institutions with which we all interact and benefit from each day. The economics of the transatlantic slave trade and the exportation of cotton allowed in the United States to position itself as a leader in global trade for centuries. Our nation continues to profit financially from exploitation of the descendants of enslaved Africans. Thank you. And with that, I'll pass it back to LaMont.
Thank you, Rachel and Lori, for that land and labor acknowledgement. And so we want to talk a little bit about the origins of the Systems Alignment Innovation Hub, the brainchild of Systems for Action that Glenn touched on earlier. And as we all know, it's a key mission of the Robert Woods Johnson Foundation to advance health equity, right? To advance health equity for all. And we see that a critical point in advancing health equity is really the work of systems, not only like public health systems and social service systems, which is huge, right? Criminal legal systems, and also medical systems. And when we look at the growing levels of homelessness, growing levels of behavioral health concerns, when we look at the social determinants of health, lifespan, access to quality health care and education and income and all of those things, we've seen growing disparities. And for so long, our approach has been one that has been steeped in hyper-professionalism, right? And where those most impacted haven't really been at the decision-making table. And sharing power hasn't always happened in the most effective way. And so the Systems Alignment Innovation Hub is really about flipping the model of development, right? And lifting up those most marginalized as our teachers and leaders. As Glenn also mentioned, there's a lot of innovation and indigenous wisdom in ways that communities of color and disenfranchised communities heal that isn't a part of the evidence-based in literature. And so how can we begin to decolonize or expand the evidence base on what works? How could we begin to build community power, right? I love this quote by Ron Chisholm with the People's Institute. And he says, you know, poor people, poor Black people, poor brown people, poor white people, they don't need more programming, they need their power back. And so with the Systems Alignment Innovation Hub, we really aim to recruit and serve and support those bias for us organizations led by historically racially marginalized and disenfranchised communities, that they can convene systems, that they can lift up innovative ideas that could improve population level health outcomes. And so this is just so exciting as a Black gay man who was raised in the Deep South and experienced homelessness and drug addiction and have to navigate like all the different systems and how that felt, right? And some of the dehumanizing aspects of that. It is such a blessing to be here now on such a project with so many brilliant minds working to kind of really flip that model of development. Next slide. Now we're going to go deeper into the various components of what the Systems Alignment Innovation Hub offers. But as you're listening today, our ask for you all is to really share this in your networks. We have a peer learning network that we're going to talk about. We also offer targeted research funding, which we just funded 4 amazing grantees. But we also offer free consulting and TA services. And so Rachel is going to talk a bit about that. So as you're listening today, we really want you to be thinking about ways that you can spread the work of the Systems Alignment Innovation Hub. So we're really trying to reach more of those racially marginalized and disenfranchised community-based organizations that are just doing phenomenal work, but sometimes don't have the capacity to write these exhaustive grants or to design a sophisticated research methodology with rigor. And so we're here to help support in all of that. So I'm going to pass it over to Rachel to walk you through what we offer.
Thank you, LaMont. So again, just wanting to recognize the Robert Wood Johnson Foundation and the Systems for Action Research Program for supporting us to stand up the Systems Alignment and Innovation Hub. And I've included hyperlinks here. I'm going to talk a little bit later in the hour more detail about the peer learning network. As LaMont said, we do offer technical assistance and consultation. And I think Sedina or someone will be populating into the chat that hyperlink. As we describe today's components of the center, you can decide if you think that you would be interested in requesting some free technical assistance and consultation. Feel free to go to that link. And then the peer learning network, we'll talk about a little bit more detail, but this meets monthly. You'll see a little clip of what that is. The targeted research funding, we were able to fund 4 practice-based organizations. You get to hear from Community Connector in just a little bit. And actually just following this last one, the tools, guides, and resources. So we have to date published 2 guides, one on data. There's going to be a hyperlink to that actual guide, which we also have in Spanish. And then the second one is on the logic model. So you'll hear a little bit more about that in a bit. And with that, I'm just so excited to introduce, next slide, Vicki Harris, James Muchera, and Lisa Walker from Community Connector. And they're going to tell you a little bit about their grant project. So thank you all for being here today.
Good afternoon. We represent Community Connector, and Community Connector is actually an emerging community care hub. And our company's mission is to serve communities by delivering innovative, sustainable solutions that connect and improve and transform how community-based social and healthcare organizations work together in a more meaningful and measurable as well as sustainable way to improve community health. And so that is the origin of the project that has been funded by the Systems Alignment Innovation Hub, and we're very excited to be part of that first cohort. My name is Vicki Harris, and I'm actually the founder and CEO of Community Connector. And I come from a background of healthcare delivery, and then also working with community-based organizations. I identify as an African-American female, and the pronouns of she and her. I will hand off to my 2 core teammates for them to give a brief introduction. And then my co-PI, I'm actually the co-PI on this initiative. And then my co-PI will actually dive in and share with you some of the details about our funded research planning grant.
Thank you, Vicki. And thank you, everyone, for being here. My name's James Muchera. As you say, he had the co-PI of this grant and also an assistant professor of nursing at Vanderbilt University. I am a researcher, and my research interests are in cardiovascular disease prevention, especially in community settings. I'm also very much interested in breaking, these cycles of intergenerational burden of cardiovascular disease, and also very much interested in social determinants of health and all those neighborhood environmental stressors. I'll let Lisa introduce herself, and then we can proceed from there. Lisa?
Yes, good afternoon, everyone. I'm Lisa Walker. In pronouns, I guess she and her. I am the program manager for the asset project. Come with extensive experience in public health, worked in the area of, working mostly with the vulnerable, marginalized populations, passion for improving health outcomes, but working with those to improve, health disparities, addressing health disparities. And I'm excited to be a part of this project, the asset project, because it allows me to utilize a lot of my public health experience to kind of bring that to the table to help transform North Nashville into a vibrant community. So I look forward to getting to know others and working with them through this process.
Great. Thank you, Lisa. So this asset program initiative is we call it as asset initiative, planned by and for African Americans to transform North Nashville. So North Nashville is a small area in Nashville, Tennessee. And this region, around just a brief of history, around 60 years ago, there was an interstate which was to be built, and it passed through that neighborhood, and it disrupted that neighborhood such that around 50 homes were demolished, and displacement of residents occurred. And as you can think, property value dipped by around 30%. And you can just tell how that would impact generational wealth and even other things that you can think of related to social determinants of wealth. No wonder the present challenges right now, just to give an example, few ones. This region, North Nashville, has one of the nation's highest incarceration rate of around 14%. Child poverty rates is around 42% compared to the national rate at 14%. And if you can see this, you just see what is North Nashville. So there's a lot of work needs to be done here. So our project is aimed at de-siloing some of the initiatives that are happening in this region, in this locality, in this neighborhood. We aim to establish a functional micro-community care hub, which will be fostering on racial equity, improved health outcomes, and increased upward mobility for residents. And as a nurse and trained in population health, I'm very much interested in this because I do know that there's a lot of linkage between health outcomes and these other factors on financial, healthcare, food, accessibility, security, crime, and so those kind of things. So how we aim to do this is to bring different people together, cross-sectoral collaboration from public health officials, healthcare providers, social service, different organizations. We have a lot of organizations here in Nashville, both in academia, healthcare, insurance. More importantly, the community members and the public sector representatives. I'll let Vicky share our inspiration list and any other things that she would like to share at this moment.
Thank you, James. You've done an excellent job. So what has happened as a result of the interstate system cutting through this neighborhood is the decomposing of this neighborhood year after year. Then when you combine that with what appears to be intentional underinvestment to even try to level set it, what you have is the current state of events where poverty numbers, it continues to be the area of the county with the highest rate of poverty, has been since 2015. The numbers haven't changed. In fact, they have gotten worse. So we actually see this as an opportunity to bring folks together and let's have a collective impact on improving that micro community. And so we chose as our, we bring to the table, the three of us as the core team, we bring our individual lived experiences, and we also bring the legacy of our ancestors' experiences as well, and we stand on that. But we also recognize that we are in Nashville, Tennessee, which is really the birthplace of the civil rights movement with the HBCUs that are located there. Those are the historically Black colleges and universities with Fisk, Meharry, and TSU. And one of the individuals that we are all familiar with is John Lewis, who came out of Fisk University, who actually served in the House of Representatives for decades. And so we adopted him as our VIP inspiration to bring to the table to remind us that if not us, then who? If not now, then when? And so we believe that that's what we need, the mantra we need to go forth. We also adopted as our inspiration song, borrowing from that period in the civil rights movement, A Change Is Going to Come. It was a song that was recorded by Sam Cooke during the civil rights movement. We think it demonstrates the resilience that we've demonstrated resilience over the years, that we have demonstrated that we are a nevertheless group of folks and that there is hope for the future. I'll turn it back over to LaMont.
Thank you, Vicki. Ooh, you guys, your project gives me goosebumps, and I love if not us, then who? If not now, then when? And folks know that one of my favorite books is Pedagogy of the Oppressed by Paulo Freire, and he did some amazing work helping oppressed communities reclaim their power and liberation. And your project, Vicki, James, and Lisa, it feels like it has that same spirit. And one of Paulo Freire's famous quotes, he says that the power of the oppressed is the only power that can liberate both the oppressed and the oppressor. So thank you, Vicki, James, and Lisa, for your phenomenal project and much needed life-saving work. And so next slide, we're going to move on to another grantee. They are not with us here today, but their work is super amazing as well. And they're called the Mandela Yoga Project. And they're named for Nelson Mandela, whose contemplative practice enabled him to transcend his circumstance, and inspired by the loss of the founder's late sister, Sonia. The Mandela Yoga Project aims to resource people of color with chronic health conditions who live in public health crisis communities to be greater agents and their own healing and leaders of self-healing with the peers. I'm super excited about this project because we know, especially for Black, Brown, and Indigenous groups, there is a tremendous of historical mistrust with medical systems. And we read all the time about the health bias and the medical inequities. And so here, with their yoga project, their Afrocentric yoga project, they're looking at testing and the feasibility and acceptability through a randomized controlled trial and utilizing Afrocentric yoga to help reduce the metabolic syndrome, folks dealing with diabetes and hypertension, which we know are things that really impact a lot African-American community. And oftentimes we will talk about, well, these things are inherited, right? Like diabetes and hypertension is inherited, but we know very well that yes, there is a degree of things that we inherit, but it's also, with the studies of epigenetics, that when you're living in an environment of structural racism and microaggressions, and everywhere you turn, the systems, it feels like it's acting as a foot of oppression, that being in this constant state of being inflamed, right, that inflammation is the root of all disease. And so this project really aims to utilize some alternative health modalities to improve diabetes and hypertension for African Americans. And their theme song, so as part of the Systems Alignment Innovation Hub, we asked all of our grantees, like, what are the ancestors or inspirational figures that you want to invoke on this journey, right? As you all design your innovations and do that difficult but yet rewarding work. And we also asked them to have a theme song. And so the theme song here for Mandela Yoga is This Little Light of Mine, which is a Black American spiritual. So that is Mandela Yoga Project. And so we also have another fabulous grantee, United Indian of All Tribes Native Veterans Program. And when they shared, I was just blown away. I didn't know that out of all of the different racial groups, that Native Americans enlist and volunteer in military service higher than any other group. And that just struck me, right? Given the history of what our Indigenous brothers and sisters and Two-Spirit folks have experienced, right? That they're the largest group that volunteer for military service. But due to, right, structural racism and health inequities, there isn't a lot of trust with a lot of our medical systems, and especially our VA medical systems. And so the United Indian of All Tribes Foundation, their program embarks to bring together some Native veterans and VA systems and other partners to really think about how can we build trust and improve access to services for our Native veterans. And their theme song is Hold Those Veterans Colors High by Jim Boyd. And they're drawing strength from some of their Native ancestors that have served or that have led in war. Geronimo, Whitty Keeble, Pabby Boynton, Red Cloud, Grace Thorpe, Kanawa Parker, Lozen, Samuel Baptiste Piora, and their own individual spiritual beliefs and faiths. And so that's just a little bit there about the United Indian of All Tribes Foundation. And I'm going to pass it over to my colleague, Rachel, to share about the work of the Washington State Lived Experience Coalition.
Thank you, LaMont. So the Washington State Lived Experience Coalition is our fourth grantee. They were founded in 2018. And they are working on a project that will study why public health, healthcare, and social service systems fail to prevent gun violence, especially among young Black and Indigenous men. This is also a very special project. The team is made up of people who have lived experience of homelessness, lived experience of incarceration, living in poverty, being representative of Black and African American individuals, people involved with the People's Institute for Healing and Beyond. This project in particular, the two leads, so you can see Jazzy Rollins and CJ Walker have a lot of experience of having lost people to gun violence. And I want to recognize and read these names off because this was, very powerful in our grantee kickoff to hear the names of people who they were close to who died of gun violence. So Jazzy's uncle, James Gorman, who was only 38, Jamario Gorman, age 20, Trayvon Breckenridge, 19, Robert Lee, and Charlie Boy, along with the loved ones of other community members, Mac Tenuvasa, age 15, Corey Pittman, 19, and Edward Brown, age 44, who have all lost their lives due to gun violence, and may their names and memory be a blessing. This team selected as their theme song Buried Alive by Buju Banton. And when you all receive these slides, you'll be able to, if you're interested in clicking on the hyperlink that takes you to the song. But we're very excited to be working with, this is, because the leads for this, they are young adults. And so that is something that is different from the other three. And so we're very excited to work with them, to learn from them, to support them in their efforts to understand how better to prevent gun violence among young Black and Indigenous men. So with that, I'm going to pass this over to my colleague, Lori, to talk about decolonizing framework. Thanks, Lori.
Thanks, Rachel and LaMont. And I hope just with slides alone doesn't give you the depth and breadth of the passion, the desires, the hope that are built into those efforts by the practice-based organization. So thank you to Community Connector for being here and for calling in your ancestors. I thought that was so powerful. So thank you for sharing that with us. Next slide, please. So my journey with the systems alignment community includes this pledge for truth over comfort. Now, I promise that won't hurt. And colonization shows up in our world every day throughout. And with the efforts of the Systems Alignment Hub, we seek to identify dominant voices, perspectives, and narratives that often shape mainstream strategies, research, and best practices. And then we will decenter those in order to amplify the voices, experiences, learnings, and histories of people who are often erased in our framework for racial justice, equity, and transformation. Could we go to the next slide? I want to make sure that we're seeing what I'm sharing. Great, thank you. So we all must be able to position ourselves as active participants in a decolonization movement for political liberation, social transformation, renewed cultural kinships among all of us, and a development of an economic system that serves rather than threatens our collective life on this planet. So decolonization and indigenization means many things to many groups. And for the purpose of our journey together, we are proposing to use the terms in this way. Next slide, please. There we go. I think I might have the slides flipped back. So when I say next slide, we can go back to the initial one, but stay on this one. Sorry, go back to that next one. There we go. Thank you. So for our purposes and the way that we're going to use these terms for the System Alignment Innovation Hub is that decolonization is this process of undoing colonizing practices. This means confronting and challenging the colonizing practices that have upheld and influenced systems that create injustice, inequities, disparities, and the chains of poverty. Decolonization is also about cultural, psychological, and economic freedom towards self-determination, towards how community members solve community problems. And that's what LaMont was saying about flipping things on its head. How do we give the power back to those who are closest to the problem? And when you think about indigenization is the act of making something more native. And when I mean more native, I mean transformation of some service or idea to suit a local culture, your local community, your members who are there within the community. It brings those strategies, research, actions, problem solving to the local community level, not within a stuffy boardroom or university think tank or city hall. It brings it to the people. And utilizing this framework would have power, dominance, and control being rebalanced and returned back to the community. And Indigenous ways of knowing and doing are perceived, presented, and practiced as equal to Western ways of knowing and doing. And more importantly, equally valued. Can we go back up to that slide that was before? Thank you. So when we are speaking about a decolonizing framework to consider in your efforts in systems alignment, we will be sharing how Indigenous wisdom and methodologies could be used. And when we really think about Indigenous wisdom, it's about completely changing how we think and how we see things, including approaches to change in non-Indigenous communities. It means we have to shift our entire way of looking at the world and decolonize and indigenize. So if your movement's goal isn't specific to engaging and solving Indigenous community needs, this doesn't mean that you shouldn't consider how you could use decolonization and Indigenous wisdom. This is an opportunity in using decolonization and indigenization to help propel different types of thinking, fresh perspectives and approaches to solving big community problems. Indigenous wisdom and methodologies challenge us to reconsider how we know things, how we study them. And these Indigenous methodologies are not just indigenous to Indigenous people. This is how all of our ancestors approached change, built community, evaluated themselves from time immemorial, before the construct of colonization, imperialism, and racism. And the path that the Systems Alignment Innovation Hub is journeying on is not just for us to think about how we should engage and approach any tribal communities and partners, but also what Indigenous methodologies could be adapted and used for the impact and change that you are seeking in your communities. The question I'm going to leave you with today is, just like we apply Western methodologies to address a problem we are solving, how could we use Indigenous methodologies to solve that same problem? I hand it back over to LaMont.
Laura, I just love listening to you. Learned so much, and we're so blessed to have you as a part of our team. So we're going to talk a little bit about equity-centered design really briefly, and I'm going to go very fast because we want you to see the clip for the Peer Learning Network. But if we can go to the next slide. And so the reason why we're lifting up the decolonizing and indigenization framework, it's coupled with our equity-centered community design framework. And so, if you will, the decolonizing and indigenous framework is the wisdom, the spirit, the soul of what we're doing, right? It's that lens that we are bringing, that fire that we are bringing. Paulo Freire, with Pedagogy of the Oppressed, he often says that that reflection without action is just verbalism and pontificating and kind of intellectual masturbation, right? And that action without deep reflection is activism, right? And not that activism is bad, but when we combine reflection, that deep wisdom, that spirit and that soul of the work that we're talking about, and we combine that deep reflection with action, then we have praxis, and praxis is transformative. And so we really are marrying this decolonizing indigenization as part of our reflective practice, and equity-centered design as part of the action to come up with something that is very transformative for our grantees in the work that we're doing. Next slide. And so just to give you a kind of taste of equity-centered design and how we're kind of flowing, right? This is the kind of flow of the journey that our grantees are going on. And step one is inviting diverse co-creators, right? And that's their partners. Who's their partners at the table for this innovation or grand challenge that they're trying to solve? Like Community Connector, right? They're trying to solve this grand challenge of improving population level health outcomes in an area that has growing poverty rates at 42%, right? Highest incarceration rates. And so their innovation and grand challenge is going to do that. So what are the partners they're bringing? How are they going to bring public health, the medical sector, and social services, and people most impacted to the table as diverse co-creators to provide that oversight and guidance for the innovation that they're developing? And then when we invite the partners to the table, right, When you invite the medical sector, public health, and social services to the table, everyone's on a different place in their journey. And sometimes we just want to go right into the work, right? The agenda, right? White supremacy, white dominant culture. But no, we need to pause. And when the partners come to the table, we need to humanize the table. And we need to ask the question, how have we all been harmed and are benefited from this issue that we are trying to solve, from this grand challenge that we are trying to solve? And by each partner talking about their harms and their benefits and the history, that they can all get clear together. They can begin to build community together. And then they move on to the power analysis, right? Because again, everyone's on a different stage in their equity journey. So how do they build a shared consciousness of the issue and the kind of drivers, right? Keeping this kind of inequity in place. And so the power analysis is a very interactive dialogical tool that has some question prompts where folks are able to look at their population and examine the systems that are charged and are funded to address this issue, and to unpack in what ways are the system putting up barriers or acting as a foot of oppression to maintain these inequities. And then lastly, what is our role as a liberated gatekeeper? How are we going to be accountable to communities most impacted? How are we going to move in the developing of our innovation so that we are moving away from savioristic approaches that quote unquote help the helpless, right? But instead returns power back to communities most impacted. And then the outer part of that circle is kind of that traditional human-centered design. Empathize, looking at qualitative and quantitative data, defining our problem and beginning to ideate on solutions and developing our innovation and the research design that we will then pilot later. All right, so I'm going to turn it back over to Rachel to talk a bit about the Peer Learning Network.
Thank you so much, LaMont and Lori. You can learn so much more about equity-centered design and decolonizing framework if you want to join our Peer Learning Network, which meets on the 4th Tuesday of every month. I just have to look at my notes here, from 1:30 to 3:00 p.m. Eastern Standard Time. Again, that's the 4th Monday of every month. Sadina has put into the chat the link where you can register for that. Also, you can see there's a link to look at the last 6 or 7 sessions. I promise you it's going to look very different than other grant learning processes that you've attended. We have just some incredible dialogue. We have typically around 30 to 35 attendees who come and learn and share their lessons in practicing some of these new skills and tools. And so really encourage you all to join that. And also, if you have any questions, Sadina is going to put in the chat, but you can email us at SAIH@tacinc.org. Next slide. I think we're going to have to skip this recording, but I do want to, because this is a 3-minute segment of one of our peer learning networks, and it's where our incredible, talented, brilliant colleague, Nastasia Moore, who leads and facilitates all of these sessions in partnership with the rest of our team and our guests, an interview with Thomas Cotton, who is with Morehouse. Well, he's with an organization and is working in partnership with Morehouse University, and they're a grantee of the Systems for Action, the last year of awardees. And so I would encourage you at a later date to take a look at this recording if you're still not sure about joining the Peer Learning Network, because you'll see just, again, our incredible Nastasia Moore, our colleague who leads these sessions. She's just so powerful. And with that, next slide, I would like, oh, there we go, to just again lift up these resource guides that we have produced. Again, I think Sadina will put the links in the chat. We would love for you to download these, to read these, to share them, to promote them. Send us an email with any concerns or considerations or things that we might want to, as we move forward in developing our additional 2 resource guides, one related to developing partnerships between bias for us led community-based organizations and academic and healthcare medical systems. So we welcome you to take a look at this. And with that, next slide. All right, I think we just, we wanted to open it up. Glenn, we'll kind of let you take it from here for any questions or answers related to Community Connector, our guest from Community Connector, or for any of us with the Systems Alignment Innovation Hub.
Thank you so much. What an exciting initiative we have underway. I'm sure all you would agree with me on that. So we've got a few minutes for questions from those of you all who are along with us today on the webinar. So please use the Q&A box that you should be able to see down at the bottom of your screen. You may need to click on the More tab. If you're not on the full screen, you'll see an option for Q&A. Type your questions in there, and we'll get to as many of those as we can in the next couple of minutes here. So, and I might take moderator's privilege and ask our team what are some of the challenges that you either are encountering or are anticipating encountering in helping to develop these community-based research projects and solutions, and some of your thoughts about how to navigate and mitigate those challenges.
Yeah, that's a really good question, Glenn. So in working with community-based organizations and with Systems for Action, we're really wanting to reach those organizations that traditionally wouldn't apply for a CFO, right? But are doing some amazing work at the ground level. And so some of the things that we've learned is how can we streamline a grant application process, right? So that it's not too cumbersome or it doesn't scare people away, and being able to provide that support. So that has been a key learning as well. Also, looking at the language of systems alignments and the academic language that we utilize and all of those things, how do we translate that so that it's more relevant and it really touches the spirit of what communities are doing? Because some communities could have a little bit of a reaction to academic rigor and evidence-based and some of those things due to the biases and some of the legacies there, right? When we talk about structural racism and other forms of oppression. And another piece, when we look at the free TA and consulting that we do, how can we make that more relevant for organizations, right? A lot of times our practice-based bias for us organizations are needing very concrete support. So it's like maybe not so much technical assistance and points on how to write a research grant, but more actual assistance with writing the research grant. And so we're really listening and learning. But I don't know, Rachel, Lori, if there's any other things that you all wanted to lift up there.
No, I think you hit it on the mark. We are learning so much, and we are documenting all of our learnings so that we can just continue to refine the Systems Alignment Innovation Hub. And so, those examples LaMont said, we're really working to correct for in the next iteration of the Systems Alignment Innovation Hub.
Fantastic. I can't resist. I'm not seeing any questions in the Q&A box. So I'm going to jump in with another one, but please, if others want to jump in, type in that question. So, thinking about our more traditional community of researchers and, people with scientific training who are also, important stakeholders in a research program like this. Your thoughts on how to do some bridge building between the scientific community and the practice-based organizations, community-based organizations that you're working with, so that we can get more productive relationships and exchanges going there. I think that's another goal of all of us working in this space, and certainly you all in the Innovation Hub have some unique skills and capacities in that regard. So any comments you want to make on that, making those connections between researchers and practice-based organizations and CBOs?
Yeah, I think one of the greatest opportunities is when you can have that kind of co-PI model. I believe it's the Lived Experience Coalition, where they have these two brilliant young men, right, that are going to be PIs, that are PIs on their project, but they don't have a lot of the more, institutional, academic, rigorous research design. And so with that particular project, they're going to be partnering with folks that do bring that and that kind of co-PI. And so here they'll be leveraging, all of that expertise and that the academic, more traditional researchers bring with all of the expertise that, CJ and Jazi bring with that life experience, right? And I think it's in those partnerships and working side by side that kind of cross-pollination happen. But I think the key thing for more of our traditional researchers, right, where we have more power and positionality, and sometimes in academia it can be very competitive environments, right? And so sometimes we have to examine kind of those aspects of our bias and our positionality so that we could work in that kind of culturally humble, mutual cross-learning that is so beneficial. And so I think one of the greatest opportunities that we have, Glenn, like you're mentioning, to kind of promote that interconnection and learning is by working together. And there's some really great examples that's happening with our grantees too.
Fantastic. And I see another question came in about how you navigate barriers of getting research published. I think that's another task. We're running out of time, but that's another task where I think, LaMont, your comment about working together. There are some good models for working together to get this kind of work published, community engaged and community-based scholarship published, and good venues for doing that as well. And I know that's also in part of the mission of the Innovation Hub, is to help community-based orgs do that work as well. So again, I want to thank our colleagues at the System Alignment Innovation Hub from TAC and HSRI, and thank our colleagues at Community Connector, one of the first cohort of community-based research projects coming through this great initiative, for taking the time to share with us your expertise and experiences and the work that's planned ahead through this work. Thanks to everybody for joining us. Just a couple of other reminders. Again, we do this webinar about every 2 weeks. So keep up to date on the upcoming schedule, upcoming webinars. If you'd like a certificate of completion, you can contact us for that. And again, if you want to access the recording for today's session or any of our hundreds and hundreds of previous webinars, you can access that on the System Alignment, on the Systems for Action website, systemsforaction.org. And then finally, next week, December 13th, we release our next call for new research proposals. So please keep an eye out for that. You can access that from our website, again, systemsforaction.org, or from the Robert Wood Johnson Foundation's website, rwjf.org. Stay in touch. Let us know how we can be helpful in your work, and we hope to see you again at this space very soon. So long, everybody.
Bye-bye. Thank you.